Hello people, how are you? In this video, let us look at this question. List 3 differences between cartilage and bone. So it is cartilage versus bone, and they have asked only 3 differences, remember, and it is for 3 marks. Okay. So let's get started. Both are part of skeleton, remember, both are the part of skeleton. Bone is also part of skeleton, cartilage is also part of skeleton, and both are connective tissue. What are both? Both are connective tissue. I am giving you more information here. So both are connective tissue, remember. So these are similarities actually. Okay, so now let us start off with the definition of cartilage. If you want to write, what is it? So we already told you it is a connective tissue. Yes, and what are the cells? The cells are chondrocytes. Everywhere you see chondro, remember cartilage, chondrosarcoma, chondroblastoma. So chondro is what? Chondro refers to what? Cartilage, ma'am. Cartilage. Very good. Which are the cells in the cartilage? Chondrocytes. Very good. Then in this there are some fibers. Fibers. Which fibers are there? Yellow, white, something and all is there. Color. Okay. In some of the cartilages in the microscope, you will be able to see the fibers. Some of them you will not be able to see. Okay. So what are there? Some cells are there. Some fibers are there. Okay. So this is in a gel-like matrix. Which is the word here? Matrix. There is a gel-like matrix. Inside this only you have what and all? The chondrocytes and the fibers. Okay, you have which is yellow, elastics. So many colors like I told you. And this matrix is rich in mucopolysaccharide. Mucopolysaccharide. Okay. Then coming to bone. Shall we move on to bone? Definition I'm telling you. First of all, definition if you want, you can write. I'm telling you the definition, what it is. Coming to bone. Bone is also a connective tissue. It's a part of skeleton. Yes. What does it have? It has osteocytes. Did they mention here? What does it have? It has osteocytes. Osteocytes. Okay, you can write that word. Okay, now let's continue here. So what is there in this? Calcium. Very important to say. What is there in the bone? Calcium. One of it is calcium. With calcium you have phosphorus and all that. Okay. So what and all is there here? Calcium phosphate. I will show here. Calcium phosphate, calcium carbonate and other salts. Which make it hard and rigid. Because of all this calcium only, what is it? It's hard and rigid. What is hard and rigid? Bone. Okay, so basically it can give you the structure for your body, weight bearing and all that. Okay, so bone is a part of skeleton. It will give you structure, weight bearing, etc. Okay, so you got the definitions. Now let us move on to the actual differences table from the textbook. Okay, so here is the differences from the textbook. You have to write textbook answer. You cannot write Google answer, right? So write cartilage is what? It's firm. Bone is what? Hard. Bone is what? Hard. Cartilage is firm. Bone is hard. You can write that. Okay. 1 point done. This one you will write. Then here what will you say? Chondrocyte. So there. Here you will say osteocytes. Here you will say chondritin. Chondritin. The material is what? Chondritin. Here what is the material? Ossein. Here the matrix is what? Ossein. Like something you remember. Okay. Let me zoom out. Okay. Make it a little smaller, please. Thank you. So what is there? Calcium. Calcium. Where will you find the calcium? Bone, ma'am. Bone. Very good. Then, so there is no calcium salt in cartilage. Very good. Cartilage does not have nerve supply. It does not have blood supply. What is this? No calcium, no nerve supply, no blood supply. But what does it have at all? It has chondritin, it has chondrocytes, etc. Okay. But then if it has nerves, doesn't have nerve supply, that means it should not feel pain. Yes, it is insensitive. Cartilage is what? Insensitive. But when the cartilage wears out, what will happen? The bones will rub against each other and they'll cause pain. Correct? Okay, that part of it you should understand. Okay. Then it is avascular. Cartilage is what? Avascular. No blood supply only. Then how does it get nutrition? Through diffusion. Through what? Which is the word you will write? Diffusion. Very good. Then is there bone marrow in cartilage? No. Of course, bone marrow is in what? Bone. Very good. What does this bone marrow do? Produce your red blood cells, white blood cells, etc. Correct? And your platelets? Yes. Now, last point here, people. Growth is oppositional and interstitial. That is from within, it's saying. See, this is textbook, so you have to read the textbook, correct? So what is it? Growth is from within. That much part I can understand. For cartilage, growth is from within. For bone, what? For bone, the growth is from the deposition on surface. Okay. The growth is only by apposition, by surface deposition. What do you mean by this word apposition? Apposition means next to each other actually. You know what? Like, let us say if there is a bone here, okay, and now there's a fracture here, okay. So if you want this bone to form again here, wherever there's a fracture, you need to keep them in such a way that they are opposing. APP, opposing. So then it will form. So that's what I'm understanding by the statement, okay. So they asked for 3 points, 6 points are there in this table. There are many more differences that you can write. Even if they ask this question for 5 marks, you should be able to write, okay. So let's look at it that way also. So basically what this has, no, this cartilage, around it, whatever is there, it is called as the perichondrium, okay. Around the bone, whatever you have, that is periosteum. Okay, around bone, what do you have? Periosteum. Around cartilage, what do you have? Perichondrium. Yeah, but around articular cartilages, you don't have perichondrium. Okay, around articular cartilages. So those, they cannot regenerate. So that is why when you become old and you have degeneration of your articular cartilages, they don't regenerate. That's what the textbook says. Or probably very slow, very little, something like that. Okay. Let us go a little beyond the exam. Okay. So look at this. When cartilage calcifies, that means what? Some calcium has come here, correct? Calcifies. The cartilage also got off some calcium now. So what will happen? It will become like bone. They didn't say it will become bone. They have written bone like. The textbook says this, so we're going with this. What does it say? Bone like. Okay, so now for more marks, we want to write what are the types of cartilage? Hyaline cartilage, which are especially in your joints at the end of long bones, hyaline cartilage, then fibrocartilage, then elastic cartilage. 3 types are there. Okay, types of bone based on, you can say, compact bone, cancellous bone. So many other types of bone are there, and so many other classifications also are there. But what do you mean by compact bone and what do you mean by cancellous bone? See, compact bone is outside. Okay, this part of it, and cancellous bone is inside, the spongy bone. Okay, so basically this compact bone, what you're seeing, you can see those circle there. Let me zoom, or let me show you this circle you're seeing here in the compact bone. So basically this is there, these circles are there in compact bone. What is this? These are the Haversian canals. Haversian canals and Volkmann's canals you have. Okay, so we'll come to that structure anyways. So you have understood, when they ask you types of cartilage, you can write hyaline cartilage, fibrocartilage, elastic cartilage, and if somebody asks you type of bone, based on the content type, you can say compact bone, cancellous bone, etc. So now let us look at some microscopy or some diagrams that possibly you can draw to get more marks. So here you go. So this is cartilage, and this side you have the bone that we are showing here. So cartilage, they have shown you the main things. What are they? You have the chondrocytes, then you have a matrix, and there may be some fibers which may or may not be visible based on the type of the cartilage. So what do you have? Chondrocytes, which are there in lacunae, right? And then here you have the matrix. And what are the types of cartilage? Hyaline cartilage, fibrocartilage, elastic cartilage. Okay, now coming to bone. Bone, what do you have? You have the compact bone and the spongy bone. Okay, and focus people. Compact bone is here with the Haversian canals, etc. In middle, you're seeing the spongy bone, which doesn't have the Haversian system. Okay, so basically this is the bone. So in case people, you want to draw one microscopic structure of for bone, if I'm saying if you want to draw, then you can draw this one. So basically what is this? This is bone. Which type of bone? Compact bone. And what will you draw? You can draw circles like this, which are osteons, right? And in the middle of that, you can show Haversian canal, which is like, you can show like this Haversian canal. Then just draw some concentric rings, right? So that we can easily get some good marks. And then you have to show some osteocytes, which are just highlighted here. You can see some dot osteocytes. Okay, so you can draw one diagram for bone also. Okay, now coming to the next part, people, differences means there can be functional differences also. Tomorrow, let us say in the exam, they don't ask you difference between cartilage and bone. They'll ask you the functional differences between cartilage and bone. Then what will you do? Then I will say, ma'am, that cartilage is also a part of skeleton. Bone is also a part of skeleton. Very good. Then you say both are connective tissue. Yes. So what are the functions? So let us come to the functions. So basically you have articular cartilages. What do you have? Sometimes you have articular cartilages. What do? They do shock absorption. Shock absorption. So you can draw this type of a joint diagram. How to draw joint diagram? If you want, I will just draw one quick diagram for you here. So you can think this is the femur. Then here you can draw the tibia. This is knee joint, right knee joint. Here you have the fibula. So 3 bones you have drawn. Now you draw the articular cartilage like this on that bone and this bone and shade the articular cartilage. Okay. I'm just telling you how to get more marks. So this is what? Cartilage. So you can name that as bone and this is bone and these are articular cartilages. And what do you have here? You have the synovial cavity with the synovial fluid. Synovial membranes will be inside. Let me draw off that also. Wait. One synovial membrane I will draw here. See, this is synovial membrane. Correct? And inside all this, what do you have? Synovial fluid. So this becomes your articular, what is this? Joint, knee joint. So the articular cartilage, then there is synovial membrane, then there is synovial fluid. So again there is synovial membrane. Then there is again articular cartilage and then there is bone. Okay, so I'm just saying. So this fluid is completely surrounded by the synovial membrane. Okay. So what is the job of this? It is the shock absorption. So you can just say all these extra words: resist compressive forces, enhance bone's resilience, support the bony areas where there's need for flexibility, etc. Okay. So that much you can write. Now coming to something else called as a cartilaginous joints. So cartilaginous joints, if you have studied, you have the primary cartilaginous joints and the secondary cartilaginous joints. So for that, the example is the epiphysis and the diaphysis. So let me draw a diagram for you so that you can understand. So here if you have a long bone and this is the epiphysis and then here you have the diaphysis. Between these two you have the cartilage. So this is a cartilaginous joint, primary cartilaginous joint, hyaline and this will later it will ossify, correct? So this is primary cartilaginous joint. It doesn't allow that much, it doesn't allow movement. That's what it says. Coming to secondary cartilaginous joints, like your intervertebral disc and your pubic symphysis, etc. It allows little movement. Okay, it has fibrous cartilage. So actually here the difference here is it has fibrous cartilage, but they're saying it allows little movement. So this is a little difficult for me to digest because when you say fibrous joint, remember, fibrous joint in the skull, that actually doesn't allow movement. That's what they had said. But here, when they're saying fibrous cartilage, which is there in the cartilaginous joint, it says it allows little movement. Okay. Look at this. Let me prove with proof. See, this is fibrous joint, right? In the skull, etc. These are either immovable or permit slight degree of movement. Okay. So they are basically, the idea is that they don't allow that much movement. That's what it looks like compared to the synovial joints, etc. Now, when it comes to secondary cartilaginous joint, what they are saying is, compared to the primary cartilaginous joint, these actually permit limited movements. Because the fibrocartilage, it is compressible. Yeah, now let's get back to bone. Functions of bone. Yes, we very happy to say the functions of bone. It forms a part of this. Forms a part of the skeleton. It gives shape and support to us. It resists any form of stress, that is weight bearing. It is what? Weight bearing. Okay, structure, strength, etc. Then what does it do? It provides us attachment of muscles, tendons, ligaments. Yes, it provides what? Attachment of muscles, ligaments, etc. It acts as lever for muscular actions. Flex your flex. Okay, all that. Then coming to protection. How does it protect you? The skull protects your brain, the thoracic cage protects your heart, the vertebral column protects your spinal cord. Okay, protection done. Then bone marrow manufactures blood cells. This is really very something that people forget. You tell them bone. What is their bone? It just gives strength. And no. It makes red blood cells, white blood cells, platelets. Who makes all that? People get surprised when you tell them it's the bone that makes all your blood cells. Yes. Then it stores calcium and phosphorus. What does it store? Calcium and phosphorus. Actually, it's composed, I would say, of calcium and phosphorus, right? Then then what else? This paranasal sinus is there in your head, in your skull, I would say. That will help in some voice effect. Okay, sound effects. Okay, now let's move on, people. We are done with this slide. Let's move on. Just 2 more slides are there for difference between cartilage and bone. Okay, example you should give no. For then you will get some more marks. Cartilage, example you tell, means the best one you can say is thyroid cartilage. Just touch this in your neck. It's actually a cartilage, not a bone. And when you say other cartilages where nose, just touch that nose tip. Yeah. Behind that actually it's bone, but then in front actually it's cartilage. Then costal cartilage, ribs, when they are attaching to the sternum, they are attaching via the costal cartilage. Do you want a photo of that? Look at this. This is costal cartilage. Okay, then knee joint. Knee joint we already drew and show. Very good. Intervertebral joint, what is it? It allows slight movement. Yeah, very good. Now let's go to bone examples. Bone examples, everybody will say ribs. Very good. Then what else you'll say? The femur, yes, the longest bone. Then humerus in your arm. Then sesamoid bones like patella. So many examples for bones are there. We have how many bones in our body? 206 bones as an adult. But as a baby, you have more. They'll all fuse. Baby has more, remember. They'll all fuse later. Cartilages in body. We'll just play with the system. Okay. Number of cartilages in the body. 3 types of cartilage, but there's no count for cartilages. Okay. So how many are there? 206. We'll just update in adult. Okay, now we are done with this slide. Last slide here. See, if you write clinical anatomy only, you will get marks, correct? So look at this. Cartilage clinical anatomy, you can write intervertebral disc prolapse. Okay, so look at the diagram to understand. So this center part, see how it has herniated because this surrounding part, that is the annulus, has ruptured or something. This is intervertebral disc prolapse. Then with age, what will you get? Osteoarthritis. That means what? Degeneration of this articular cartilage between your bones in the joints. Then coming to any tumor of cartilage, chondroblastoma, chondrosarcoma, chondro word is there. Come to bone now. Clinical anatomy. First thing you'll say fracture. Yeah, very good. Then bone marrow biopsy. You go into the bone to get the bone marrow biopsy. Then osteoblastoma, osteosarcoma. Just observe here. Between these two. Chondroblastoma, osteoblastoma. Chondrosarcoma, osteosarcoma. Like that. Okay. Bone marrow biopsy, where do you actually do? Pelvic bone. It's actually saying hip bone. Okay. See how they are taking bone marrow. So that's all, people. Not 3 marks. I think we have learned for 30 marks now.